All right, it's 1 o'clock, so I think we'll get started. This is Claire Crooks from the Center for School Mental Health, and I am happy to welcome all of you to our third and final webinar about our Mental Health First Aid First Nations project. For those of you just joining us today, we've already had two. One that's an overview of the program development and vision of mental health first aid that was conducted by Ann Seymour a couple of weeks ago. I did one last week on program outcomes, and this week is on the importance of cultural safety in programming and research. And if you're interested in seeing those earlier ones, we'll give you the links because they're now on our website. So thank you for joining us today, and it's a pleasure for me to introduce Andrea Lapp, who I've been able to work with for almost 10 years now. Andrea is a Ojibwe from Aamjiwnaang First Nation, and she is a researcher here at the Center for School Mental Health on a number of different projects. Right now she's coordinating the Mind Up for Young Children project, but she has worked extensively on this Mental Health First Aid First Nation project that we're presenting today. And she's also worked with Indigenous youth in healthy relationships, program development, implementation, and evaluation for the past 8 years. And has been involved in developing and implementing our mentoring program in that respect. Andrea is a mother, a partner, a mentor, a collaborator, writer, and research with interest in the areas of wellness, school success, and positive mental health for First Nations youth. And she has a bachelor's of medical science and a certificate in writing from Western University. So Andy, thank you, and we'll hand it over to you. If you have your slide yet. Good, perfect.
Yeah, I'm not sure. Oh, okay. It looks like we're good. We had a little problem uploading the slides, but it looks like we're good now. Thanks everyone for joining us. I am speaking today about the importance of cultural safety in programming and research. Okay, good. So in this presentation, I'm going to start by describing cultural safety and talk about cultural safety specifically in research. I'll speak about cultural safety within our research process of the Mental Health First Aid First Nations evaluation. And then I'll talk about our findings about the cultural safety within the Mental Health First Aid First Nations. And I'm not going to go over completely what Mental Health First Aid First Nations is because we had the first webinar, a really great description of the program and the course, and then our outcomes that Claire described last week. So if you missed those two, you can always go back to our website and check those sites out.
Hi, Andy. Yeah. Sorry, I think you're going in and out a little bit, so if you're using a big external mic, just make sure you stay close to it.
Okay, thanks. So I'd like to introduce our research team. Kim Vanderwoord from Reciprocal Consulting BC and her colleagues, Billy Joe Rogers, Cassidy Karen, Monique Auger, and Sam Tusaruda. Claire Crooks and I represent the Center for School Mental Health at the Faculty of Education at Western. And missing from this group photo is Angela Snowshoe, who was integral in the creation of the original concepts of this evaluation project. I'd also like to acknowledge and thank our partners, the 10 First Nations communities that that allowed us to visit them as part of this research, the Mental Health Commission of Canada and CIHR, who provided the funding to look at the feasibility, the implementation, and the impact of mental health first aid First Nations. So first, what is cultural safety? Cultural safety is an outcome and a process, and it's defined by the recipient of care. It's typically applied in an Indigenous context, and the receiver of care, when they feel safe and protected in their cultural identity, their practices and their perspectives are respected despite any real or perceived differentials in power. And it makes programs and services more effective for Indigenous people. The concept of cultural safety is relatively new. It originated with the Maori Indigenous people in New Zealand and their insistence that health service delivery changed for the better for them. And the concept of cultural safety was then supported by Maori. It's based on recognizing that power differentials are built into the health services and other structures. and recognizing that these inequities can be addressed through education and through respectful partnership. Cultural safety requires reflective practice on the part of the provider of care, the researcher, etc. And what that means is to look within and understand that our relationships are impacted by our culture, our subconscious thoughts, and our ingrained. And we need to acknowledge that we all bear culture and that this culture affects our relationships. Sorry, I don't know if you guys are having problems hearing me. I'm trying to stay really close to the mic, so just let me know if it keeps drifting in and out. So cultural safety, it goes beyond cultural awareness, and it goes beyond cultural sensitivity and cultural competence. Cultural awareness is being cognizant, observant, and conscious of similarities and differences among and between cultural groups, and it's a good foundation. Cultural sensitivity is one step further, and it's not assigning values to the cultural differences and similarities, whether that's assigning more positive or more negative value. Cultural competence is the application of knowledge, skills, and attitudes or personal attributes that's required by service providers or researchers to create respectful relationships with diverse populations. And typically, the values that underline cultural competence are inclusivity, respect, valuing differences, and equity. And these definitions are from the Aboriginal Nurses of Canada. And so while cultural competence is an important concept, it doesn't take into account the systemic barriers, power differentials, and the historical context, which means that alone cultural competence is inadequate to fully address the inequities within healthcare, within health promotion programming, and within research sometimes. So cultural safety goes beyond these concepts, and it really addresses the root causes of these health inequities. And I just wanted to take a moment to recognize that although the concept of cultural safety is relatively new, like I mentioned, the concepts that underline, or the values that sort of underlie the concept of cultural safety and the values that contribute to effective care are not new. And these are traditional values that guided the life of the Anishinaabe. These values, humility, honesty, respect, courage, wisdom, truth, and love, these are the way that things were for the First Nations peoples of Turtle Island. And I think that the more we can get back to these values and intertwine the traditional teachings with the mainstream mental health care, the healthier we will all be. So now I'd like to take a moment to talk about cultural safety within research. So here are some concepts that can help to apply cultural safety to research. Communities, First Nations communities should be able to choose their priorities, their research questions, what they want to know, and choose the research process that they are the most comfortable with. Community members ideally should lead the research. Research focuses should be on the community strengths and focus on the upstream sources of individual and collective resilience. Researchers really have to identify and challenge the Western assumptions, or the organization assumptions of superiority, and researchers have to reflect on the impact of our theories, our methods, and how the methods affect the participants, and reflect on not only the findings that are created, but also the way that the findings are shared to ensure that there's no stigmatization or exclusion. Can everyone hear me okay now? I hope I'm not drifting in and out. Okay, so So speaking about sharing of knowledge, research dissemination is a really important part of the. Okay, great. Thanks, Nicole. Awesome. Good. Okay, so sharing knowledge is an important part of the research process. It's more than publishing results. It's about sharing results in a meaningful way and increasing access to the research findings. And that's a big part of why we decided to do these webinar series to share back the information in a way that hopefully can reach a lot of people. And I'd also like to just briefly talk about the OCAP Principles of Ownership, Control, Access, and Possession. They were developed and trademarked by the First Nations Information Governance Center to increase the self-determination for First Nations individuals and communities over research. And our evaluation was guided by these principles and operationalized through promotion of participant level ownership over the data. And one way that we did that was by sharing the interview transcripts right back with the participants after we interviewed them. So sometimes we would literally flip the laptop around and share their words back with them, and they could say, no, that's not what I meant, and use that chance to sort of change what they wanted to say, or we would send the interview transcript back to them just so that it was clear who owned those words and that story. We also provided accessible language, community-specific summaries to each site that we visited for this evaluation within a few weeks of returning home. And while we were conducting the site visits, we wanted to ensure that the participants were empowered to understand the purpose of the research and their autonomy over choosing if and how their knowledge would be used or would contribute to the bigger picture. So cultural safety in mental health first aid First Nations, the course. The Mental Health Commission of Canada began working in 2011 on creating a more culturally relevant and safe version of the mental health first aid course so that it could be used in First Nations contexts. And they worked with First Nations consultants, a First Nations guidance group, and 3 First Nations community sites to co-create this adaptation. The concepts of holism and balance, which are very important aspects of First Nations well-being, are guiding concepts throughout the curriculum. Walking in 2 worlds is another overarching theme throughout the course, which encourages participants to look at both worlds, so to look at the Western and the First Nations perspectives when it comes to mental health. Circle of Support is an activity that involves brainstorming all of the available mental health supports in the specific community and writing these supports on a big dry erase image. And finally, EAGLE is the acronym that helps participants remember the first aid actions. And in the basic version, the acronym is ALGAE, and it's changed to EAGLE because that concept reflects the ego, which in First Nations communities is symbolic and has functional importance in many First Nations communities, if not all of them. Okay, First Nations cultural relevancy within the mental health first aid First Nations course. So I think that there was a lot of underlying concepts that were used in creating the course, and that the Mental Health Commission of Canada, First Nations communities, and the guidance group built into the curriculum. So first of all, culture is the foundation of health and wellness for First Nations. So understanding that First Nations ways of thinking and being are critical to the restoration of First Nations health. Mental health is developed and maintained for First Nations people through connectedness with family and community. And the course, I think, does a good job of teaching non-judgmental ways of understanding mental illness, which is extremely beneficial. The historic context, which influences current realities, and that applies at the individual personal level as well as the community level. And finally, Mental Health First Aid First Nations is, as a course, is supporting the revitalization of traditional helping roles within communities and empowering the participants to work together as a community to support one another in regaining their mental well-being. So our, sorry, I think my slides are a little bit out of order here, but this is a quote from Albert Marshall. And the reason why this is here is because now I'm going to talk about cultural safety within our evaluation. And for our evaluation, we decided to use the two-eyed seeing approach. And two-eyed seeing was created by the elder Albert Marshall, who said, "Learn to see from one eye with the best in our Indigenous ways of knowing, and from the other eye with the best in Western ways of knowing, and learn to use both eyes together for the benefit of all." So this approach to our research, the two-eyed seeing approach, it mirrors the Mental Health First Aid First Nations course, and specifically the Walking in Two Worlds, because it values equally both the Western medicine when it comes to mental health and the First Nations knowledge, and using both of those together create a stronger program. So we wanted to recognize in our evaluation the importance of Indigenous people's stories and experiences. So we used a concurrent mixed methods approach with a stronger weight placed on the qualitative data. And speaking of storytelling, this is another quote from Albert Marshall, and he said, "Traditionally, nothing was taught as black and white. Everything was story, where you have the responsibility to listen and reflect. This is a much more profound way of learning because you have the opportunity for a relationship with the knowledge." So our overarching methodological framework embodied Indigenous community-based participatory research principles. So we valued contextual reflection. We placed an emphasis on relationships, respectful relationships, and we wanted to benefit the communities through our research, and we prioritized Indigenous ways of knowledge transfer, which is oral or interviews or storytelling. We made the decision to focus much more on relationship building with course participants and de-emphasize the arm's length neutrality from our fourth site visit on. From the fourth site visit on, we participated in the course, we built relationships with the participants, and this process was really important to build the trust with the group, which encouraged them to participate in the interviews and the paper surveys. In the first 3 site visits, we didn't do that, and we didn't participate fully. We were more of a neutral observer, and then we did a survey at the end, but our participation was very low, so we decided to strengthen the relationships and build the trust, and our participation rates went way up. In our introductions, when we visited the sites, we shared information about the research. We explained the importance of gathering feedback and how participants' voices would be honored and reflected in our research summaries. And like I said, we remained engaged in the course, and we listened when participants were sharing their feedback and thoughts all throughout the entire 2.5-day course. For our research process, we actually made space for the community members to co-create the questions, our research questions, and identify the appropriate methods. So it's pretty interesting. We proposed photo voice as a culturally relevant approach for data collection, but our community partners felt that photo voice would be too much of a burden to place on the participants because the course can already be a pretty intense experience for some, and didn't feel that the benefits really outweighed that burden. So they indicated that their preferences were to see us use a strengths-based survey and short face-to-face interviews. So that's what we did. And I just have a quote to share from one of the facilitators who spoke specifically about his thoughts on our research. He said, "The intellects and the doctors, there's nothing wrong with them, but the girls," meaning us, the research team, "they come to our communities, and that's where the real work happens in community. The real knowledge comes like that, working hand in hand together. You can't look at the manual and understand what happened on Tuesday. When you come to our community, it means something." And he said that in reference to the different ways that the Mental Health Commission of Canada was gathering feedback on the manual, the Mental Health First Aid First Nations manual. And he was referring to some doctors and researchers who were going to be editing the manual, and he was saying that it's important to have both, not just the research-backed mental health information in the manual, but at the same time, you need that community-based implementation fit. Otherwise, the manual may not be used if it's not culturally appropriate. So that's why the culturally appropriate evaluation. And as he said, working hand in hand together. That's why it's so important. And now I'd like to share some of the experiences of cultural safety, some of the findings of cultural safety in the Mental Health First Aid First Nations course. So overwhelmingly, the majority of participants from all of our site visits reported on their surveys that the course was a safe space to discuss their culture and their views, 97%. We also looked at the Mental Health Commission of Canada survey data, which was a much larger sample of people who took the course, not just at the 10 sites that we visited. And collectively, these two sets of estimates identify a very high degree of cultural and emotional safety among the course participants. And I just want to point out that there is a small number of participants, approximately 3%, 3 to 5%, that don't experience the course as safe, which is important too. So now I'm going to go over some of the course components that contribute to the cultural safety that was felt by the overwhelming majority. So first is the cultural components of the course: ego, colonization, and historical trauma, which is the first sort of session of the course, and the cultural knowledge that is intertwined throughout. So for example, one participant said, "When I was younger, after coming out of residential school, I wondered why I drank, I did drugs. It wasn't until later I realized the issues. Residential school was never a topic in mainstream schools, and the conditions and the impacts. This kind of training helps me understand the parts and the roots." So for this person, this participant was speaking about the importance of learning that historical trauma in terms of understanding not just the people in her community, but also herself. The other component, the second component that I want to talk about that contributed to cultural safety of the course is offering the cultural teachings, which was commonly done by the facilitators and the elders. They incorporated local First Nations worldviews into the curriculum whenever possible. And they also, I think, did a really good job of remaining open to the diversity of the participants within the group. And they often included cultural processes throughout the course, such as prayer, smudge ceremony, and gift giving. So one participant said, "The smudge and talking circle at the opening and closing were wonderful to start and end the day. I felt that the training in space worked well with my cultural beliefs, but the facilitators also repeatedly spoke about praying in our own way and offered time to share our cultural stories." Another factor that contributed to cultural safety is the adaptability and flexibility of the course. It's not specific to my area, but if I were to deliver it, I would add our history, our realities. I would be comfortable with what is there, the major oppression, colonization. I would build on that to be specific to my base. The flexibility was commonly reported as an enabler for cultural relevancy and safety. Participants reported that the course would be culturally safe or culturally relevant in their communities, especially given the flexibility. Anyone can take this course. You don't have to practice ceremony or go to church or not practice faith. You can take this course, and it is a non-judgmental way, no matter what your beliefs are as a First Nations person. So the course was also noted to be flexible in that it's suitable for anyone, including First Nations, non-First Nations, as well as First Nations people with different levels of cultural connection. Community localization, another factor that promotes cultural safety within the course. We found course participants reported the importance of having the facilitators who were either from their community or have knowledge of their community, their local culture, their territory, and their language. The Circle of Support activity is a localized example because the participants list all of the available community resources in their specific area. So it's helpful, again, for situating, walking in two worlds, situating ceremonies, elders, traditional healers as supports, as well as enhancing the course material by drawing on local resources. During the course delivery, participants discussed the importance of the Circle of Support exercise numerous times because it prepares people to identify those supports in the event of a crisis where they have to support someone in order to get support and professional care. So this Circle of Support activity is particularly important for people in a remote reserve who may lack appropriate resources that many of us have in urban centers. And community-specific examples, the facilitators had amazing examples of how they would adapt the course to give. So, for example, if 911 services were not available in the community, then the facilitators obviously would know that and not give that example as a resource to suggest in the case of a mental health emergency. And finally, the final factor that contributes to cultural safety of mental health first aid First Nations, we found was the facilitators and the elders. During the site visits, we noticed that the facilitators related the course content to their own lived experiences, and when they openly shared their stories with the group, they in turn helped to create that connection for the participants and helped them feel safe to share their own stories as well. And a lot of the participants said that the storytelling was a huge part of the course for them. And interestingly, one of the participants who didn't feel safe during the course indicated that it was a facilitator who kind of made them feel uncomfortable just by the way that they were referencing or shutting down any challenges to the course content. So I think this is just a really good example of why the facilitation and the elders are such an important part of the cultural safety of this course. So in conclusion, the legacy of colonization and the way it manifests in mental health challenges among First Nations communities in Canada, given that there's a huge need for mental health promotion and culturally safe initiatives. And although cultural safety can be very challenging to measure, it's critically important. Cultural safety was a huge contributing factor to this course in every step of the way, including the design, the adaptation process, the facilitation, and the evaluation. Cultural safety to us isn't just another one of the gains that we measured in the participants. It's actually what we feel facilitates the other gains in mental health literacy and mental health skills. And that cultural safety is actually necessary for the success. So we want to encourage any other researchers out there to include cultural safety in your research and explicitly ask about it and how their participants are feeling. Our findings on the cultural safety of mental health first aid First Nations is extremely encouraging, and we think that those positive results are based on the cultural content, the freedom to include local traditions and teachings, the localized activities, and of course the delivery of the course.
All right. Thank you, Andy, for your thoughtful discussion of this and how we envisioned cultural safety, both as a course development piece that the Mental Health Commission and partners undertook, as a process piece for how we did our research, and as an actual outcome. Any questions from participants? Just go ahead and type them into the chat box, and we do have a few minutes for Andy to answer questions. Am I in
I
the
just
chat?
wanted to mention these are the references for my presentation, and these slides will again be posted on our website. And you can always email me or contact me if you have any questions afterwards.
Yeah, the slides will be posted, and also the actual recording will be posted. We also, I think we've mentioned this other weeks, we have our project summary is currently posted on our center website. And if you look in the chat box, Nicole Bullock gave the website address for that, and our full technical report will be forthcoming shortly. All right. I'm not seeing any questions. Nicole, am I definitely in the right place? All right.
No,
okay.
There's no question.
All right. Thank you, everyone, for your time. And thank you again, Andy, for wrapping up this webinar series. Take care.
Bye, everyone.